Welcome to Season 5 of Public Health on Call.
Dr. Mashika Roberts, thank you so much for joining me today on Public Health on Call. How are you doing?
I'm Joshua
I'm doing well, thanks. How are you doing,
Vice
Josh?
Dean for Public Health Practice.
I'm good. I'm excited to talk to a health commissioner who has
in Baltimore, Maryland.
been
Our goal
through
with this
COVID,
is to
from the very beginning. How long have you been the health commissioner in Columbus, Ohio?
Critical health
I've been the health commissioner
If you have
December
questions or ideas for us, please send an email to publichealthquestion@jhu.edu.
I'm guessing the last couple of years were not exactly the same as the first couple of years on the job.
Absolutely not.
For future
Absolutely
podcast
not. Night
episodes.
and day.
So I'd like to start by asking you to tell us about the experience of COVID in Columbus from your vantage point. What have been a few key moments for you?
So, every community has their own experience with COVID-19. And I think for me, I will say off the top that I'm very fortunate that I have a very supportive mayor and city council, and for the most part, a very supportive community through this pandemic. When this pandemic started for us here in Ohio was really March of 2020. And I always say it was a turning point in my career, at least looking back at this point. We have a large festival that happens every year in Columbus called the Arnold Festival. It's like a mini Olympics, and they bring people in from all over the country.
You said the Arnold Festival?
The Arnold Festival, as in Arnold Schwarzenegger. He has a commitment to Columbus because this is where he got one of his first medals or wins. And so he comes back every year and has this athletic competition. And it's everything from cheerleading to gymnastics, but also bodybuilding. And they also have a huge expo where it's basically like a huge mall shopping area where people just come through and roam and can buy different athletic products.
How many people are we talking about coming to the Arnold Festival in Columbus, Ohio?
Over 100,000 in the course of 4 days.
Wow. And that was scheduled for March 2020.
That was scheduled for the first weekend in March, as it is every year, of 2020. And as I said, they bring people in from all over the world. And so we had been working with the organizers for several months to make sure that they were excluding or had some type of screening process for individuals that were coming from what we believed to be the affected countries at that time, which were, anywhere between 4 and 8, depending on who you asked at that time. And so we thought we had a good understanding of what they were doing. I was working with the state health director, who was obviously concerned. It's a huge income revenue, tax revenue for the city as well as the state. And the Monday before the event was to take off, I woke up with just a gut feeling that this should not be happening in our community. We are not prepared. We don't have testing resources here in our state. And when they have this big expo, there's no ticketing. There's no way to know who was there, who wasn't there. So we wouldn't be able to do contact tracing, which obviously people are very familiar with now, but public health has been using that for decades. So I grew concerned. I woke up, I called the state health director, and I called my mayor, and I said, I've got some concerns. And I was fortunate that they listened to me. They didn't ignore me. As a result of those discussions, we ended up having discussions with the governor. And we started talking to lawyers and trying to figure out what our legal authority was as a local municipality, as a local health commissioner, as a mayor, as well as a state. And then the final decision was that the state would tell them this was not a good idea and they could not have this event.
I mean, what's going through your mind at that point? Because there's got to be some little voice saying, what if I'm wrong and I'm going to have 100,000 people, not just 100,000 people, but 100,000 people who lift weights, angry at you?
Yeah, I will have to say I felt very strongly about the science, about what I was recommending. There were so many unknowns, and I was fortunate to have the support of the state health director, who clearly knew the state was not prepared to do the testing, to do any of the case investigation. But, I'll be honest with you, Josh, I was a little African-American woman talking to a room full of men, mostly Caucasian men. And they were listening to me, and they were relying on my expertise as well as the expertise of the state health director.
Well, you can say now, I can imagine, but you were so right looking back. And I wonder whether any of those people called you to thank you, because a lot of people who were at that event could have been quite sick.
Yeah, I've gotten a lot over the course of the months that followed. A lot of people said, wow, I'm amazed that you knew what you knew then, because most people didn't understand COVID-19 at that time. But, just a few weeks later, the governor shut the whole state down. And so people got it. People got it pretty quickly.
What you did not only protected people in your community, but it also made it clear that you were there. You were there to really help. So what else did you do? What's another significant memory? What was the next kind of big step forward for Columbus?
Well, I'm really proud of our community. Our hospitals really partner together. We have 3 adult hospital systems here in Columbus and 1 pediatric or children's hospital here. And we work very well collaboratively together on a number of different issues. But during the pandemic, we came together, and it was clear, particularly when testing became more available, that there were many in our community who weren't attached to a healthcare system and didn't have a way to get COVID-19 testing. And obviously, I was very concerned about those who were Black and Brown in our community who didn't have the access to testing. So I came up with an idea that we would provide testing here at the health department. We have a nice little circular driveway in the front of our building. We're right off of a main drive area. And so I partnered with the hospitals, and they all agreed to come pick a day of the week. We did it 5 days a week. Some hospitals did more than one day, and they would provide that COVID-19 testing. So they would have the staff that would do the swabbing, they would run it in their lab, and all the residents had to do was call us at the health department, and then we would make sure they got registered for the testing.
Now, some hospitals, if they got a call like that from the health commissioner, might say, we are offering testing, but people have to come to us.
And I wanted it to be centrally located, easily accessible. We wanted it to be drive-through out of the safety of our staff, the hospital staff, as well as the residents we were testing. And so that worked. We did that in the front loop here in our driveway from June to October of 2020. And then we ended up moving that operations to our state fairgrounds. And we continued that same operation at the state fairgrounds until June of 2021. Again, in partnership with all 3 of the adult hospital systems. And it was a seamless plan and one that we're all really proud of.
How many people wound up getting tested?
I'm afraid you were going to ask me that. We easily tested, 2,000, 2,500 a day at times. So I don't know the exact number off the top of my head.
It's a big number.
It's a big number.
That also, to me, speaks of, your authority in the city, not just shutting down the Arnold Festival, but getting hospitals, which I'm sure compete with each other on a day-to-day basis, to come together and really support people in the city, particularly people who may not even have good access to care in the usual times.
Yeah, you're absolutely right. I am fortunate that I have hospitals that want to partner with public health. Again, it's about those relationships, and I think I've done a really good job of trying to maintain those relationships. Here in Columbus, we call it the Columbus Way. We all come together and do things together collectively for the good of our people. I still talk to the CMOs. I talked to them this morning. We talk once a week now. We all are going through withdrawals of thinking when that's going to stop because we're so accustomed to seeing each other at 7 a.m., at least via Zoom. But I'm fortunate to have that type of support in our community.
Tell me about something else that you particularly remember in this incredible period.
Sure. So I think the other thing that I'm proud of our team is we knew when the vaccine rollout started in December of 2020 that there could be some challenges getting people vaccinated. And as our state opened up different age groups, we continued to see a low percentage of minorities coming to get their vaccines. And so we came up with a plan of how do we motivate and get our minority population to get vaccinated. And my team came up with this Vax for Cash program. Where we would give a $100 Visa gift card to anyone who started their vaccine series through us. And they could get any vaccine. They could get Moderna, Pfizer, or J&J. And we launched that in July of 2021 and ended it just this January. So January 10th, I think, is the last day. And we gave over 27,000 first dose vaccines in that time. But what's most impressive is throughout that time, we became the #1 vaccine provider for the minority community here in Central Ohio, which is Columbus and the greater metropolitan area. Prior to the start of the Vax for Cash program, about 31% of those we vaccinated were people of color. Post the Vax for Cash program, about 60% of those we vaccinated were people of color. And then the other thing that is most intriguing about what we did was we really were able to lower that gap between the highly socially vulnerable index neighborhoods and the low socially vulnerable index neighborhoods. And prior to the Vax for Cash, the gap was about 22%. So people in higher socially vulnerable neighborhoods were 22% less likely to get vaccinated than the lower socially vulnerable. And then that gap was increasing almost 1% each week. And then post the Vax for Cash, we were able to move that gap from 22% down to 19%. And now that gap is decreasing almost 0.12% every week. So we made some substantial inroads on our Vax for Cash program. And it merely makes me reflect, how could we use that type of initiative on some other disparities that we see in our community?
Great. I want to definitely return to that, but just to ask, as part of that effort, were you involved in countering misinformation, disinformation?
I'm so glad you asked that question, because the program was really so much more than just giving the $100 Visa gift cards. We did outreach in the neighborhoods prior to going to those centers. We had health educators at the vaccine clinic who could answer questions for the public before they even made a decision to get vaccinated. And we decentralized our vaccine clinic. Instead of having that drive-through clinic that we had at the fairgrounds, we had one here at the health department. We also went into the neighborhoods where we knew we had low vaccine uptakes, going into rec centers, going into religious centers, really trying to meet the community where they were versus expecting them to come to us.
I think in our conversation, we're really talking about some really important roles of public health. There's the shut down the conference role of public health. But that, was a stressful week, but it was really just a week. There's the healthcare system role of public health. And this is a role of public health of really looking out for communities that are most likely to be left behind or in trouble.
Mm-hmm. Absolutely. That's what I love about public health. We wear so many different hats and we're doing so many great things for our community.
So, how are things these days with COVID in Columbus? I'm wondering, based on some of the headlines we see around the country, are public health departments just packing up all the signs and everyone taking a vacation, or where do you see things? I say that obviously in jest, there's a lot to do, but where do you see things right now?
Well, I do think we're starting to see a little bit of light at the end of the tunnel. And, whether I call it endemicity is near or whatever others want to call it, but our numbers are going down. We are still in the red zone per CDC's community transmission. But over the last 2 weeks, our rates and our positivity has gone down by 50%. We're sitting at a case rate of about 295 cases per 100,000 right now here in Franklin County, which is where Columbus sits, and a positivity rate of about 14%. We are starting to release more of our staff to go back to their daily jobs. So that's good. We've been in ICS structure, which is the incident command structure, and managing this outbreak or this pandemic since really March of 2020. And we started to change our operational periods, expand them, change the meeting frequencies, changing our report frequencies instead of every day, 3 times a week and things of that nature. So I see that we're going to some sense of back to normalcy and dealing with this virus in a different way than we have over the last 2 years, which is good. But we also have a lot of other public health work that has either been lost or had to be pushed aside during this pandemic that we need to address.
So looking forward, you mentioned that maybe in the Cash for Vax program or Vax for Cash, sorry. Okay. There may be some lessons for other issues, but maybe just speaking a little more broadly, your health department's never going to be the same. Your career is never going to be the same. Your outlook on public health is never going to be the same. What do you hope to bring from COVID to make Columbus a healthier city?
Well, I hope that we can all learn, one, to respect each other. And I think, we have a different level of respect and after we've gone through this and made judgments about different people. But really what I'm hoping that we come out of this as a better community and really can help address the disparities. At the very beginning of this pandemic, as well as throughout, we saw issues with homelessness and how do you deal with people in the shelter? How do you deal with people who are incarcerated? How do you deal with pregnant women? How do you deal with those living with the disease of addiction? And we saw that those individuals, including mental health, were really at the fringes during this pandemic, and we didn't have the appropriate structure in place to support them and help them. And so I'm hoping that on the other side, we can really think about what do we do moving forward with those individuals, with those communities, and then those elements in our community to help them. And are there incentive programs or are there resources that we can help to improve those? I mean, that's what I'm really hoping. And then obviously I've got to deal with my staff. The mental health of my staff is frayed, like any clinical staff, and just trying to make sure we support them and we can keep them and maintain them, as well as recruit new public health employees. So I got a lot on my plate.
Well, let me tell you, this has been such an inspiring conversation. You are a pandemic hero without a question. And I wish you the best for all these big projects that you have in store for Columbus. And thank you so much for joining me today.
Thank you. Thanks for having me, Josh. Appreciate it.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.